HPV, short for human papillomavirus, is one of the most common sexually transmitted diseases. There are over 100 types of HPV and there are 30 sexually transmitted. Researchers keep track of the different types of HPV by identifying them with numbers. HPV is passed on through genital contact, most often during vaginal and anal sex. HPV may also be passed on during oral and genital-to-genital contact. HPV can be passed on between straight and same-sex partners, even when the infected person has no signs or symptoms. A person can have HPV even if years have passed since he or she has had sexual contact with an infected person. Most infected persons do not realize that they are infected or that they are passing the virus on to a sex partner. It is possible to get more than one type of HPV. Very rarely, a pregnant woman with genital HPV can pass HPV to her baby during delivery. HPV can cause normal cells on infected skin to turn abnormal. Most of the time you cannot see or feel these changes. In most cases, the body fights off HPV naturally and the infected cells then go back to normal. But in cases when the body does not fight off HPV, HPV can cause visible changes in form of genital warts. Warts are growths on your skin that look like tiny bumps, and they are usually in or around the vagina, anus, or on the cervix, or on inside of the thigh. They may be raised or flat, large or small. Warts are pink or flesh-colored, red or brown. Some bumps grow together and look like cauliflower. HPV is limited to the basal cells of stratified epithelium, the only tissue in which they replicate. The virus cannot bind to live tissue. Instead, it infects the epithelial tissues through microabrasions or other epithelial trauma that exposes segments of the basement membrane. The infectious process is slow, taking 12 to 24 hours for initiation of transcription. It is believed that the involved antibiotics play a major role in neutralizing, while the virions still reside on the basement membrane and the cell surfaces. E6 and E7 are HPV proteins associated with cancer. The E6 and E7 proteins inactivate two tumor suppressors proteins, P53 inactivated by E6 and PRB inactivated by E7. HPV virion invades a cell and an active infection occurs, and the virus can be transmitted. Several months to years may elapse before this can be clinically detected. What can basically happen is the infected area on your body remains totally normal. You may never know about it, but you may give the infection off to others. Your body then usually clears off the infection. Or bumps called genital warts can be seen in your genital areas. They almost never lead to cancer. Or HPV infection persists, leading to cancer of the cervix, vulva, vagina, and anus in women, or cancers of the anus and penis in men. The safest way to prevent getting HPV is to not have sexual contact. If you are having sexual contact, it is important to know that you can reduce your risk of infection by having sexual contact with one partner who is only having sexual contact with you. Using condoms every time you have sex gives you some protections, but condoms aren't perfect. Another prevention option are HPV vaccines. Gardasil is one, which is for both men and women, and cervix, which is only for women.